You guys already know that we had a group of nurses go viral this week in Santa Barbara. Why? Because they were bullying their patients. They decided that it was a great idea to post photos on social media mocking them and then showing the stained exam pads. Yes, they were fired. But let's be honest for 1 second. The only reason they were fired and held accountable for their actions is because the post went viral. Because the reality is, if this had actually stayed private, it would have been a slap on the wrist. Because that's how the medical industry works. Because when you file a complaint against a doctor or a nurse, it doesn't go to an independent board. It actually goes to a board made up of other doctors and other nurses. And what does that do? Creates bias. I know this firsthand because I filed a complaint with the Arizona Medical Board against a doctor who wanted to play big shot bully, so he tried to run me over with a car and then harassed me for 8 months. Didn't know him. He was just an ass. I was told I'd hear back in 3 months. It's been 5. Crickets. Now, why is this? Easy, because doctors know how much money, time, and school that it takes to become a doctor or a nurse. It's not easy, and I respect that. But they also don't want to strip that away from someone, so they ignore the complaints and hope that they go away. And this is why patients are no longer safe, because the system that is supposed to hold doctors and nurses accountable, it's broken. Filming content in hospitals and in doctors' offices, that shit should be banned altogether. I mean, give your patients some dignity, respect, and privacy, for God's sake. Stop turning them into your next TikTok content. I think the worst part about all of this is just simply the truth that the healthcare industry has the highest workplace bullying incidents in the United States, and it also costs us billions of dollars annually. The only difference now is they're not just going after their coworkers, they're going after their patients. What is shocking, however, is just how normalized bullying, harassment, and abuse has actually become in the medical field. Now, if the good doctors and the good nurses out there want to protect their patients, and I know that there are good doctors and good nurses out there, I do believe that. But if you want to start protecting your patients, it's time to start standing up and demanding a little bit of change in your industry. Accountability cannot come from peers alone. Patients' lives are much too important for that. So let's make an echo that says healthcare should heal people, not humiliate them.